Bismillahirrahmanirrahim. Today is you are so focused on the future that you don't realize today was what you paid for years ago. My name is Dr. Amna Khalid. Today I will be presenting the topic of sampling techniques under the kind supervision of Professor Dr. Saira Afsal. Learning objectives for this presentation are we will define what is population sample and sampling, differentiate the two types, probability and non-probability sampling, select the appropriate sampling technique, identify the what will be the sample size, and apply the sampling methods in research. So why sampling is needed actually because studying the entire population, which is labeled as census, is often expensive, time consuming, logistically difficult, and sometimes impossible. For example, in the real world, population includes all children under 5 years in Lahore, but we take the sample of 600 children selected from Lahore. Therefore, researchers select a representative subset, which is called a sample. These are the key terminologies used while studying about the sampling techniques. Population, which is the entire group of interest. Study population, which is the population accessible to us. Sample, which is the subset of population. Target population is the population to which results are generalized. Sampling frame is the list from which sample is drawn, and sampling unit is the basic element which is selected, and that can be individual, household, school, village, and so on. So, if we compare census with sampling, census covers whole population, and whole population is studied in it, while in sampling, a subset is taken and studied. Census is highly accurate, sampling is less accurate than census. Census is expensive while sampling is economical. Census is time consuming while sampling saves over time. The feasibility of census is that it's difficult for large populations and sampling is practically possible. So good sampling has some characteristics which include that it should be representative, means accurately reflects the population. It should have adequate size. It should be large enough to draw the valid conclusions. Then it should be free from any bias, no systematic skew in the selection process. And then it should be reliable, means it should be consistent with the results if repeated, and precise. There should be small margin of error. This is the sampling process. First of all, we have to define the research question. Then we define the target population. Then we develop the sampling framework, the frame, and select the sampling method. We calculate the sample size. And then according to that size, we select our sample and collect the data. So the flow follows from defining the question through to actual data collection. This is a classification of sampling. We classify it into probability and the non-probability sampling. Probability sampling is the one where every member has a and non-zero chance of selection. This includes different types like simple random sampling, systematic, stratified, cluster, and multi-stage sampling. We will go through the detail in next slides. Non-probability sampling is the one where selection probability is unknown. It includes convenience, purposive, quota, snowball, and consecutive sampling. So now we come to the detail. First of all, we will see simple random sampling. Each member of the population has an equal and independent chance of being selected. The methods used can be lottery method, random number table, computer generated random numbers. Steps involved in simple random sampling is, first of all, we prepare the sampling frame, then we number all the units, then we generate random numbers, and then we select the required sample. Next one is systematic sampling, where selection at a fixed interval, which is the K point, from a randomly chosen starting point. The formula to calculate K is that we divide capital N with small n, where capital N is the population size, as we talked about that the number of the children in whole Lahore, and then the small n, which is the sample size. For example, 600 children from among those a whole population of children. Then this K will be the sampling interval. For example, if we have a population of 1000 people and we have to take the sample of 100 from them, then K will be calculated by dividing 1000 with 100, and that will be 10. So there should be an interval of 10, and the starting point will be a randomly selected number. So the steps are we have to determine what is K. We will use the formula. We will and then we will randomly choose the first number, and then we will select every kth individual. Next, we have a stratified sampling where population is divided into homogeneous subgroups and that are strata. Random samples are drawn from each of the strata then. It can be proportionate, where sample size is proportional to the stratum size in the population, and it can be disproportionate, equal or unequal numbers selected deliberately regardless of the stratum size. It means if we talk about this, that we have more female in our population, and we take 60% females for this reason and 40% male, then this will be proportionate, that we have selected the sample size according to the stratum already present in the population. For example, we have the faculty in medicine, nursing, and pharmacy, and we take and we have 500 students in medicine. So accordingly, we take a sample of 50. We have 300 students in nursing. So according to that number, we take 30 students as a sample. And we have 200 students in pharmacy. So according to this number, we take 20 uh, students as sample. So this is the proportionate, which is relating to the total number present in the population. So now we come to the cluster sampling, which is that natural groups or clusters are randomly selected. Then all or some members within the selected clusters are studied. For example, in the population, we have 100 villages, and we randomly select 10 villages. And then from those 10 villages, we study all the households. So common cluster units can be villages, or schools, or hospitals, or households, or districts. Advantages are that this is economical, convenient, and useful for large populations. But the disadvantages are there are large sampling error and it is less representative. Then we have multi-stage sampling, which is sampling performed in successive stages with units selected at each level, used in large scale national surveys. All right. Means if we have a province, uh, we move forward from the province to districts, then we select some tehsils, then the villages, then the households, and then from among those households, we study the individuals. For example, if we have Pakistan DHS survey, and we take it as example, then we first of all we select district from the province, then we have the enumeration block from the district, and then we select the households from that enumeration block, and then we select the women present in all those households. PPS is the probability proportional to size. Means the larger clusters have greater selection probability. This is used in WHO, EPI, and the demographic health surveys. Non-probability sampling is the one where chance of selection is unknown. Participants are chosen based on convenience, judgment, or availability, and it has different types. We will go through the detail. For example, we have purposive sampling, where participants are chosen because they possess specific characteristics. It has various types like maximum variation, where We capture wide diversity of experiences. Homogeneous, where we select similar participants for focus study, or expert sampling, where individuals with recognized expertise are selected. Typical case, where we take representative or average cases. Extreme case, where we take unusual or deviant cases. Or critical case, where we take high importance cases for insight. Then we have snowball sampling, where existing participants recreate future participants from their network. These are used for hidden populations like drug users, sex workers, MSMs, and the migrants. In the conjunctive sampling, every eligible participant is included until the target sample size is reached. It's used commonly in the clinical studies and hospital-based research. Advantages of this type of sampling is it reduces the selection bias and every eligible patient gets a chance. So this is the summary of probability and non-probability sampling differences. In the probability sampling, the selection is known, is random, where the probability is known. And in non-probability, as the name shows, it's non-random and non-probability is unknown. Bias is low in probability and a high in non-probability. Representativeness is again high in probability. Generalizability is more strong in probability. Cost is expansive in probability. Sampling speed is lower in probability sampling. And we require sampling framework in probability sampling. And quantitative studies use probability sampling, and qualitative sampling are more inclined towards non-probability sampling. So selecting the appropriate method of sampling, we ask some questions like, is a sampling frame available? If yes, then we choose the probability sampling. If resources are limited, then the better option is cluster and multi-stage sampling. If the population is hidden or hard to reach, then snowball sampling is better. If we need subgroup analysis, then stratified sampling is good for it. This is all about the sampling techniques. Now we come to the MCQs. Question number one is, a researcher wants to estimate the prevalence of obesity among 5,000 medical students. He assigns a number to each student and uses a computer-generated random number list to select 400 students. Which sampling technique is being used? Option A, stratified; B, cluster; C, simple random; D, systematic; and E, convenience.
D.
C is the right answer. Question number two, a public health researcher has a list of 2,000 households. After randomly selecting the first household, she chooses every 20th household. Which sampling technique is this? Option A, simple random; B, stratified; C, purposive; D, systematic; and E, color cluster.
D. Systematic.
Yes, now this is systematic. Previously it was simple random. Question number three, our university has 60% females and 40% male students. To ensure both genders are represented proportionately, the researcher selects participants separately from each gender according to their actual proportion. Which sampling technique is being used? Option A, cluster; B, stratified; C, snowball; D, quota; and E, consecutive.
B.
B is the right answer because we are talking about the two strata. Question number four: our survey team randomly selects 20 villages from a district and studies every household within those villages. This is an example of option A, cluster sampling; B, stratified; C, systematic; D, purposive; and E, quota sampling.
Cluster. A.
Yes, C is the right answer. Question number five, in a national nutrition survey, researchers first select provinces, then districts, then villages, and finally households. Which method is this? Option A, simple random; B, consecutive; C, snowball; D, multi-stage; and E, systematic.
D.
Multi.
Yes, please, the right answer. Question number 6. A researcher studying injection drug users asked initial participants to refer other drug users they know. Which method is this? Option A, cluster, B, purposive, C, snowball, D, stratified, and E, systematic.
C.
No.
Yes, snowball. Question number 7. A hospital-based study recruits every eligible patient attending the diabetes clinic until the required sample size is achieved. This method is option A, consecutive, B, convenient, C, cluster, D, stratified, and E, quota.
B.
Option
So
A
that
is the right answer. We are talking about the eligible patients. So this is option E. Question number 8. To explore experiences of mothers caring for malnourished children, a qualitative researcher deliberately selects mother with extensive caregiving experience. Which method is this? Option A, simple random, B, purposive, C, systematic, D, cluster, and E, consecutive sampling.
B.
purpose.
Yes, purposive. Question number 9. A researcher stands outside a shopping mall and interviews the first 100 people willing to participate. This method is option A, stratified sampling, B, systematic, C, convenience, D, cluster, and E, multi-stage.
C.
Convenient.
Yes, now it is convenience sampling. Question number 10. An investigator decides to include 50 males and 50 females in a survey but selects them based on availability rather than random selection. Which method is this? Option A, stratified, B, quota, C, cluster, D, purposive, and E, consecutive. Option
Consecutive.
B is the right answer. We have the two groups, males and females, but we do not select them randomly. This is the difference between quota sampling and the stratified sampling. In stratified sampling, we have two strata, and in those two strata, we select the members randomly. In quota sampling, we have again two groups or more than maybe two groups, but we have the stratas or groups, but in those groups we select them non-randomly. So this is the difference, and this is the answer key. This is the YouTube channel of IPH where this presentation will be uploaded. Thank you so much.
Thank you so much, Dr. Aamna. I want to get a little information. I want to know when are these classes are going to continue into summer break as well, and when is